Alright guys, we're talking about a quick differential diagnosis between a hamstring strain and maybe something else. In this guy's case, it was a sciatic nerve irritation. So this was a person that I saw not too long ago dealing with some kind of back of the knee pain and overall leg pain. And they were coming into clinic because they had reported that they injured this while exercising. So the first question that I asked them is, did you have any, did you have any pain right away? They said yes. And this was a couple months ago when this happened, but the biggest question was, did you have any bruising? Did you hear any popping? Was there any those types of sensations? And he reported he didn't have any of those. He went to his doctor. He's waited for a long period of time. He's tried medications. His doctor said it's probably just a prolonged hamstring strain, and he's just going to either have to live with it and wait and see if it gets better, or, maybe try something that may help, like physical therapy or something else. So when he came into the clinic, he told me that he didn't have any of those original symptoms, like the popping, no contusion-like symptoms, no bruising, and he started to describe things that made his symptoms better or worse, which gave me the most information. So I'm trying to keep a keen ear on what things make him better and worse. And in most cases, with things that are coming from the back, or if you're having sciatic nerve symptoms, sometimes somebody will report that your symptoms are very variable, meaning walking feels better one time and then sometimes it feels worse. So it all depends. In this guy's case, it was pretty specific, as sitting for long periods of time made his knee pain worse. Initially standing, that was usually better. Walking is better than sitting. Sometimes the standing was feeling better, sometimes not. It just depends on how often he sits. And that was a question that I asked him, was, does it make a difference if you sit for 5 minutes and then stand versus sit for an hour and then stand? And he said yes. So that's a kind of a big cue in as far as where I think the symptoms are coming from. So in his case, the biggest thing when it comes to like a physical exam, or when I'm actually looking at him and trying to move him around, is, so I'm thinking hamstring versus sciatic nerve irritation, which is in the back of the knee. So as soon as I just kind of palpate and touch the back of the knee, bam, right in the middle of the knee, the central portion of his posterior knee, right where the sciatic nerve runs, he's like, man, that hurts. That's my irritation. That's my symptom. So what I did next is I tested the strength of the hamstring and just looked for any sort of pain. We're trying to reproduce his concordant sign or his concordant pain. So what we did is we just resisted knee flexion or the hamstrings in a concentric motion, and then we did it eccentrically, so the muscle is lengthening and putting more demand on the muscle unit itself. Neither one of those created his pain. We also stretched the heck out of the hamstrings, no irritation there. And then we did what was called a slump test, which looks at nerve irritation specifically for the sciatic nerve, and then you can differentiate it and make it more specific from there if you need to. With him, I just did a very general slump test, and as soon as we got his legs straight, if you're not sure about that test, you can check it out if you're interested. But we have somebody slump, they slouch, they put their head down, you straighten one knee, and then you look for if they're having symptoms or not. As soon as we had him slouch down and he straightened his knee, he's like, bam, that hurts. Okay, so now I'm thinking it's probably the sciatic nerve. Now we're going to get some other baselines for him. So I had him squat, I had him walk, I had him do some goblet squats with a little bit of weight. And all we did is identify what level of pain he had and, how many reps he could do. And then from there, what we did is some interventions. So for him, we looked at the back and we did some back interventions, and then retested all those things. And he was about 50% better. So squatting was pain-free. He was still having some issues with the weighted squat, so he needs to, accommodate to that load. But we found that the slump test was not as irritating, and we found that squatting was less painful, and he was doing better with that. So I sent him home with that, and as he progressed, he got better and better, and eventually got rid of it and got back to running, which was awesome. So I hope you enjoyed this video. Again, it's just a differential diagnosis between if you think you have a hamstring strain, or if it's something more nerve-related that can come from the back, maybe in the hip area, like piriformis, or just some restrictions in the hip. It can come from a variety of different places and locations. I always have a bias towards, let's check out the back and see if we can work on that and see if it makes any difference in symptoms, and then we'll kind of go down the chain, if you will, and see if anything happens and see if there's any change in symptoms. So again, hope you enjoyed this, and have a great day.